Hi, Mark Jamin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. I'd like to start with a recent quote from the paper. It went like this: "Our rights don't end where somebody else's fear begins." But then, do your rights entitle you to hurt someone else? In a nutshell, this describes a delicate dance we have to choreograph. And over the next few segments, let's look closely at risk. What is unwarranted fear, and what's being too readily dismissed? So whether you believe it's too early to open up, or you believe we can't wait any longer, whatever dance steps you prefer, the band is warming up, and we all need to be in the same dance hall for any chance to do this safely and profitably. So hang with me. Today in part one, let's dive into some terms and concepts critical to understanding what's at stake. You have probably heard of R naught. What does it mean, and what does it mean for us? R naught refers to the number of people an infected person will pass the infection to, and the important number here is 1. This means one infected person passes it on to one other. When that original person gets well or dies, that leaves behind one infected person. The total number of infected people stays the same. An R naught greater than 1 means the infection is spreading. And an R naught less than 1 means that the number of people infected is getting smaller. So we want to see an R naught less than 1. Now, even in this case, there is still virus around. People are still getting sick and dying, but at least we're getting ahead of the virus. And that's what's happening in New York right now. The R naught went from 1.7 early in March, crossed below 1 on March 31st. New cases, however, continued to grow for another 10 days until the 9th. And even with the current R naught of 0.8, they reported 7,000 new cases a day. So R naught is a complex calculation. It depends on how contagious the bug is, how much bug is around in the community, how long someone continues to give it to others once infected, and what people do to contain it. And key to understand that it changes depending on the place, and it changes over time. R naught is just a snapshot of where we've been. It can tell you what has happened, but in and of itself it cannot say what will happen. R naught indicates how much spread has happened. The doubling rate indicates how fast that spread is happening. Put them together, and we might get a clue about where we're headed. So, for instance, a short doubling rate, say less than 3 days, with a high R naught, greater than 1, puts us on a trajectory of a hotspot, soon to outstrip our healthcare system capacity. On the other hand, a low R naught, less than 1, with a long doubling time, say greater than 7 days, and we're making headway. So what about for us? In North Carolina, R naught was 1.5 in mid-March, crossed below 1 on April 7th, that's good news, but the number of new cases statewide continues to grow. In Western North Carolina, the doubling rate seems to be more than 7 days, although with our limited testing, we're not really sure. So, a low R naught, with a doubling rate that's long, and it seems like we're on a positive trajectory. Truth is, though, we don't really know the actual doubling rate. We've only been able to test about 260 people out of a population of 60,000 in Haywood County, and the other counties have similar rates. The question remains, how much virus is around? And would that matter to you if there was actually a lot more virus here than you believe? What about if there's less? Well, we now have a better opportunity to find out. As of last week, our testing capacity really ramped up. Between now and the governor's extension to May 8th, we'll get a much better grip on where we are right now and set a baseline we can use to monitor our situation going forward. What we learn now over the next couple of weeks will make a big difference in how we calculate an acceptable risk and deciding if this is the right time or not. Through Public Health, we'll continue to share test results daily so you can follow along. I hope you can see that there is no single measure, no easy way to assess our risk. And the stakes are high. If you don't believe that, have a look at what's happened in Albany, Georgia. It's going to take keeping our balance in this delicate dance. Tomorrow, I'm going to answer the question of, what does that pot have to do with your risk? So be well, stay emotionally connected, and physically distant.